everyone. It is Misha Green, DC editor, back again. I know you guys just saw me like 3 minutes ago, but I am back again and really, really excited to talk to Dr. Chanel McGoy as well as Dr. Allison Matthews on this really important subject about raising awareness, particularly regarding women's health, specifically in regards to HIV and AIDS. And truly we're dealing with the COVID-19 pandemic, but we know that there are so many epidemics affecting the Black community at once, between HIV, AIDS, just lack of access to healthcare, police brutality, racism, the list can go on. And we know that some of these conversations truly correlate. So I selfishly have a lot of questions for these ladies today about that. But you all know the drill. Before we get into the nitty-gritty of questions, we have to share the stream because sharing is caring. And particularly today, because this issue is something that really affects so many people in our community, and we have to raise awareness. So go ahead and hit that arrow and share the stream. And while we're doing that, Dr. McGoy, Dr. Matthews, how are you all doing today? I don't know. Whoever wants to start can jump on in. Dr. McGoy, you said my favorite quote today, stay ready so you don't have to get ready. So you can start us off.
Yeah, thank you so much for having us be a part of this, and really the opportunity to talk about our passion and the work we're doing around HIV, and particularly the importance for women and Black women. I'm doing well. I really appreciate being here today. There's so much that is happening around us, in our country, among our people, but I'm well. We keep moving and addressing the issues that present themselves to us, and keeping a positive attitude. And that's all I can say is that I'm well. I'm here and I'm well.
Awesome. And Dr. Allison Matthews, tell us a little bit about you and how you're doing, particularly as it relates to so much that's happening in the world today.
I'm doing well. Also, I'm trying to, we try to take the positives in each day. And so today it's warm and sunny. And have some people in our political government who are, hopefully have our best interests at heart. So that always gives me hope. And I'm excited about being, the new executive director of the Faith Coordinating Center with Gilead Compass, because that I think provides a lot of opportunity for us to be able to grow and really address at the core of a lot of the issues around stigma around HIV, and hopefully get to healing. So happy to be here.
Thank you. And again, thank you guys for your optimistic, positive answers. We need that today in so many ways. And so I thank you for bringing that sunshine and light to our Afro viewers today. Tell us a little bit about the Compass Initiative, how it started, and then we'll get a little bit further into the nitty-gritty of today's conversation.
Yes, thank you for the opportunity. So I came on board with Gilead Sciences in January of 2018. And prior to me coming and joining the company, Gilead Sciences, our leadership really took a look at how we can make an impact in HIV in the Southern US. So it began as conversations internally, and then they embarked upon a listening tour throughout the South to hear from people living with HIV, healthcare workers, administrators, people impacted by HIV, who have loved ones who are living with HIV, social workers, community-based advocates, and anyone who had a relationship or an interest in HIV. Ears were open and hearts and minds were open to understanding what could be done to address HIV. And so in January 2018, they launched the Gilead Compass Initiative. It is Gilead's largest commitment in our corporate social responsibility program, which is housed in public affairs. It is 10 years, $100 million commitment to address HIV in the Southern US. And we have three goals. The first one is to change public perception around HIV in the Southern US. There's oftentimes so much stigma, so much miscommunication, miseducation, and we really want to change the public perception. Increase local leadership and advocacy is the second goal that we have for ourselves. So really providing the tools for local leaders. There's so many amazing advocates throughout our country, and particularly in the South, who are doing this work. And we want to raise their voices, provide them with the tools and skills they need to be effective advocates. And then finally, increase access to and quality of healthcare services for people living with HIV. So this means making sure that care is culturally competent, that when you walk into a provider's office, you don't experience that mistrust or stigma, either from other clients in the office or from the providers that exist. So giving them also, the healthcare providers, the tools that they need. And so we've been in this for 3 years. We're embarking upon our 4th year, which we call phase 2. We have partners who are working in the areas of mental health, trauma-informed care, substance use, stigma, education, advocacy, capacity building, and sharing knowledge. And so with this 4th year, or phase 2 of Compass, we have invited a new partner that I am so excited about. And so that brings me to Dr. Allison Matthews from Wake Forest University. We have integrated faith into the work that we're doing. And we know how important faith is in the Southern US. And so Dr. Matthews is here to share more with you about what the Wake Forest University School of Divinity Coordinating Center will be doing around HIV and faith.
Yes, Dr. Matthews, if you can just jump right on in and talk about the very important aspect of the work that you're doing.
Sure. The Faith Coordinating Center is brand new, as Dr. McGoy mentioned, and we are excited to be doing this work. The goals of the Faith Coordinating Center are to provide funding and training to faith-based organizations and nonprofit organizations that work with faith communities. And we're taking an interfaith approach, so but focusing on particularly the Black church and African American faith communities, because we know that we are the most affected by HIV and the most vulnerable to HIV. And so a big part of the focus is really thinking about how we can create programming and opportunities to build capacity for faith leaders and faith-based organizations. And so we have different foci. One is thinking about how we help them build capacity and, establish maybe health ministries or address social determinants of health. And then the others are focusing on kind of communications and thinking about larger programming and sustainable programs within the faith communities and collaborating with nonprofit organizations. So, a lot of the work we're doing right now is kind of meeting with different faith-based organizations, getting some feedback from community leaders about what they think are some of the priorities, because I think it doesn't work if we create programs that aren't reflective of their needs. So that's some of the work we're doing right now, and also kind of getting the granting opportunities off the ground.
Thank you. Thank you for answering that question. So, Dr. McGoy, you already sort of delved into why this work was important and how you all started in terms of serving the South and what the needs were in educating and bringing opportunities and resources regarding HIV and raising awareness in the South. But can you tell me a little bit about how you even got passionate about such work and why we all should be a part of the raising awareness effort, particularly as we lead up to March 10th?
Yeah, thank you for asking that. It's an interesting story that I hope a lot of people can learn from and really share with young people. So I had returned home from undergrad one spring, dating myself. Has to be about 25 years or more ago, but came back home from school and was looking for an internship, summer job, an opportunity to make some money, but also to learn and to tie it to my interest in school and future professional goals. Always have been interested in health, particularly public health and community organizing, what we call now, we didn't back then, but social determinants of health. And so my local health department was offering an internship for the summer. And it was an opportunity to go to summer camps, recreation facilities, to work with young people on health education. And part of that health education was sexual health education, sex health education, as well as HIV/AIDS. And so I really got interested in the work around educating young people about their bodies, about HIV. And from there have been involved in public health and HIV for many, many years, almost 25 years now, and have pursued educational experiences as well as work experiences. So before coming to Gilead, I was the director for the Tennessee Department of Health, HIV and AIDS section there, responsible for prevention, surveillance, care and treatment, housing for people living with HIV and AIDS. And so in a southern state, but this new opportunity at Gilead gave me the chance to expand that experience to 9 Deep South states with the resources to really make an impact and address HIV. And you asked, why should we care? Why is it important to address HIV? People often think that it's something of the past, right? That, in the 80s, people were dying of HIV, and it's really not a concern anymore because there are medications that are helping people live long, quality years of life. That is true, but it is also true that here in the US, the southern US represents over half of the new cases in this country. So you're talking about nearly 52% of the new cases, the new diagnoses of HIV are in the southern US. So we see in some places where they're getting close to ending the epidemic, places like New York and San Francisco, among some populations. But when you look at geographic disparities and racial and ethnic disparities, those are areas that we need to address to really end the epidemic. So we're talking about Black and brown folks. We're talking about people living in the South. We're also talking about Black women, as well as gay and bisexual men.
Thank you for answering that. And it's just so amazing to me to think that you've been in this fight and hustle for over 2 decades. One, because you look amazing, but two, because, again, I think in the Black community, like you said earlier, it was something so incredibly taboo and that wasn't necessarily discussed, or now we know it was being researched and talked about depending on where you were. But it's refreshing to hear that there have been people fighting for so long on this subject. Dr. Matthews, can you talk a little bit further about why in the faith community this subject is so incredibly important? I know firsthand, I've been in certain worship experiences, et cetera, where those conversations become, people sort of glaze over it. I was really lucky, just a quick aside, when I was in high school to be a part of an organization in DC called the Episcopal Diocese of Washington's Committee on Youth. And so in that we had a high school retreat and I just rocked my t-shirt from it. Now probably, I don't even want to say how long ago, but really, really old, that says, let's talk about sex and so much more. And that we talked so much about HIV awareness at this church retreat, but there were kids who didn't get sent because their parents didn't want to talk about it in the faith setting. So again, I'm really excited about the work that you're doing, and can you tell us why in the faith community we should be having these conversations?
Well, I want to just also give some background on how I got interested in it, because I think it.
Sorry, throw that in too.
Oh, yeah. I think it helps answer some of your question. I am a sociologist by training, and I have always been interested in intersections between racial identity and experiences of discrimination, sexuality, and religiosity and spirituality, and how those things intersect and overlap. And so, when I was, kind of exploring my interests, I really dove deep into trying to understand why we had so much stigma around uh, Black and gay people, right? Like, why is that such an issue? And especially within Black churches, especially given the fact that we have this history of social justice movements and civil rights and accepting people for who they are, and this message of love. And yet within our own communities, we oftentimes were reproducing that inequality and reinforcing oppressive kind of mechanisms. And I think there are some levels of respectability politics that come into this, where we're thinking in order to combat racism, then we need to present ourselves in the best possible manner based on certain norms that are in society. So, for the faith communities, I think there is some some healing and some introspection that we take within ourselves, but also there's a legacy of social justice and advocacy and fighting for what's right. And so I have started to see that faith communities are opening up to those conversations around LGBT issues and HIV. And if you think about the Poor People's Campaign and even the documentary on PBS about the Black church, they openly had conversations about that. This is kind of a unique time in history where we can actually have these conversations and really try to move the needle forward in that way. And also just, I grew up in a kind of tradition of that kind of social justice in faith communities, and was lucky that my parents and my family and my faith community were really open to encouraging those conversations about sexuality and about health and mental health. And so I'm hoping that those kind of traditions can be able to be expanded through the faith coordinating center.
Thank you. Thank you both for your answers and the hard and long work that you've been doing um, in this work. So March 10th is National Women and Girls Awareness Day. Is that correct? National Women and Girls HIV/AIDS Awareness Day, I should say. And we know, again, that all populations are affected by HIV AIDS. Dr. McGoy talked about the specific populations that Gilead and the Compass Initiative is particularly focusing on. But why do we have a day, a National Women and Girls HIV Awareness Day? And why, particularly as Black women, should we sort of be part of leading the charge and in raising awareness?
Yeah, thank you for that question. It's an important question to focus in on women and girls as we talk about HIV and AIDS. So according to the CDC, the Centers for Disease Control, in 2018, of the new HIV diagnoses in the US, about 19% of those were women. And so when you think about the ways in which women acquire HIV, heterosexual transmission was the number one way, followed by injection drug use. And when we look a little closer at the data, when we talk about geographic region, as well as race and ethnicity, Black women account for 67%. That's almost 70% of all women diagnosed with HIV in the Southern US. So I already told you that half of the new cases in our country are in the South. Now I'm sharing that almost 70% of all diagnoses among women are Black women. So when you break these numbers down even more, you realize the urgency around addressing HIV among Black women. And it's so important that we have these conversations about our health. We are oftentimes the healthcare, the caregivers for so many others in our communities and our families, but we also need to address our own health, particularly our sexual health. And so, starting those conversations with close girlfriends, with family members, mother to daughter, auntie to niece, and having these conversations, healthy conversations about your body, about sexual health, and especially in our faith communities, it's important as well to have these conversations around HIV. And so this is why it's important that we address and have a day around HIV awareness for women and girls on March 10th.
Thank you. Dr. Matthews, do you want to add to why we should be focusing and have a special day for women and girls, but particularly in raising awareness for Black women?
I would have to, lean on some of the relationships that I've established with women who are living with HIV, and hearing, I've become close with a lot of women, and I think it's important for us to focus on women's experiences with HIV in particular, because they are very unique to other groups, right? If we, a lot of the kind of messaging and the plans and the policies are largely focused on Black men who have sex with men, or men who have sex with men in general, and yet, Black women's experiences are unique because we are vulnerable to domestic violence situations, intimate partner violence. We're vulnerable to, limited income and resources, and also limited social support. And a lot of times, the ways that we are acquiring HIV are, different. And so I think that we want to use this day to highlight some of those conversations, and also, like I said, I also lean on the experiences of the women that I know who, have called me talking about, experiences with stigma and rejection, and, kind of relationship dynamics that come into play for them, and caring for their children. And so this is not, the woman is the center of the family. And if the woman is not healthy, then the rest of the family is not healthy. And so we want to think about, the experiences and the ways that we can protect women in particular, so that we can make the whole family whole. And also, if you think about the medications that are developed, a lot of times they, people who participate in the research for developing new HIV medications are oftentimes men. And so we also want to use this day to highlight some of the important contributions that women can make to the development of new technologies and medications, because our bodies are unique and the way that we respond to medication is unique. And so we want to make sure that we're represented and thought about in intentional ways.
Yeah, I just want to share quickly. Thank you, Dr. Matthews, for bringing in the lived experience. I shared the statistics and the data, but so important and often forgotten is what Black women are experiencing and how they are acquiring HIV. And it can be oftentimes that they don't know that their partner has HIV. So I think for this day, March 10th, it's important to emphasize testing, to know your status, to know your HIV status. And if you are HIV positive after the test, your life isn't over, that there are opportunities for you to thrive and to live a long, healthy life. And so many women find their strength in talking about it, in educating other women, and being a support system, just as we've seen with breast cancer, right? Being a support system for other women living with HIV. And if you are negative, an opportunity to think about those prevention tools and strategies that are used. and also to have a conversation, to have that conversation with your partner before engaging in sex, for sure. You know, he might smell good, he might look good, he might be whispering all those sweet things and nothing's in your ear. But, you know, the importance of having conversation around your HIV status and STD status and testing.
Thank you so much for you all emphasizing all of those facts. And what's very much so resonating with me is this thought of the fact that Black women are the center, right, in the whole, make the family whole, right, but then also so incredibly vulnerable. And so it's great that we're having these conversations. I am so sad, cannot believe we've already reached the 12:45 mark, but I just have to selfishly ask this last question because I think it's really important, which is the piece of the fact that Black trans women are really a part of this conversation, and we know also a very, very vulnerable community. I'm just interested on what work that you all are doing in that arena, and then just this also is completely unrelated, but we got to work it in. And can you just also answer how you all are also tying the HIV/AIDS epidemic to the focus on health in the Black community, particularly as we also battle the COVID-19 pandemic? I know two different things, but y'all are doctors and amazing. We'll be able to make it work.
Woo, that's loaded. Yeah, that's the two loaded questions. I'll start with the trans question around trans women. So, you know, I graduated from Spelman College, had an amazing mentor, was a comparative women's studies major. Dr. Beverly Guy Sheftall, one of the foremost Black thought feminist leaders and thinkers. And so I embrace this broad and inclusive definition of gender and what it means to be a woman. So when you talk about trans women, you talk about my sisters, right? So you talk about, it's an inclusive definition of what it means to be a woman. And our trans women are facing so much. They're facing so much violence. Last year, about that we know of, about 44 trans women were murdered last year. That we know about. And so we have to stop the violence against trans women. And their numbers for HIV are also high. So through the Gilead Compass Initiative, we also fund community-based organizations who are addressing trans women's health and wellness. And through Gilead Sciences as a whole, we also have another initiative dedicated solely to the transgender community called Transcend. And so that initiative supports funding for trans organizations. But there's so many dynamics that trans women are facing: the stigma, the discrimination, the homelessness, the unemployment, the opportunity to pursue their education. And so for us as women to embrace an inclusive, holistic definition of what it means to be a woman is so important, especially among Black women. Black cisgender women and Black trans women can come together and provide a powerful collective force to address these injustices that all women face. And so I'm passionate about that piece of it, for sure. They're my sisters. No doubt.
I definitely echo what Dr. McGoy said. I would say that with the Faith Coordinating Center, we are also trying to focus on, you know, engaging faith communities who welcome transgender women and minister to transgender women. I just had a conversation with with a transgender woman leader in the community, and talking about, you know, ways that we can be responsive to the faith needs, as well as addressing stigma around HIV. I would also say around COVID that given the fact that we are also disproportionately affected by and dying from COVID, you know, we have to think about the overlap. Interestingly, a lot of COVID researchers are also HIV researchers, and a lot of COVID kind of support and the policies and programs and kind of response has been informed by the work that has been developed over the past 30 years, 30 plus years with HIV. And so I think that we can be a model for thinking about how to engage communities and address disparities around COVID. And also, we also want to be very mindful of the unique challenges that people with HIV face during COVID around access to mental health and medication and thinking about their particular bodily vulnerabilities, biological vulnerabilities, but also, just thinking about social support and access. A lot of people have been cut off from those social support resources. And so we're trying to think about, I think it is important for us to think creatively about how we can provide those resources to people living with HIV during COVID.
And I just want to give a shout out to our website, gileadcompass.com. You can find us at gileadcompass.com. There will be opportunities for people to apply for funding. If you are interested in this work, you have a community-based organization, or you know someone with a community-based organization, please share the information with them so that they can apply for funding to do the work that we know is needed in our communities to address HIV.
Thank you so much to the both of you. I am very inspired and fired up by the work that you're doing. And I just can only say that we now, all of our viewers who are watching, it is our responsibility to continue raising awareness and making sure that people are aware of this issue. Share this stream, as you all always do. Sharing is caring, but particularly in an issue that affects our community in such a major way. We don't want anyone missing out on this valuable information. So thank you so much to both Dr. McGoy and Dr. Matthews. I appreciate you. And please, I hope this is not our last time having this kind of conversation on Afro Live. So please come back and see us.
Thank you for having me.
Thank you all so much.